Hi, Mike Matthews, physical therapist here with the PT 411. Thanks for joining me. If you're over on Facebook, make sure you head on over to my main page, hit the like and follow button there. And if you're over on YouTube, make sure you hit the subscribe button so you can be notified when I come out with future videos. So lately we've been talking about the lower back and the core, things that we can do to help prevent and avoid lower back injuries. But what happens when we actually injure our lower back? Things that we need to avoid comes down to common knowledge. We don't want to lift anything, especially anything heavy. No quick jerky movements, no jumping, no quick twisting. So when we are nursing a back injury, the question comes down to what can we do or what should we do? So what do we do when we injure any other part of our body? Take our elbow, for example. First few days, we might elevate it, we might ice it, we might let it rest. We want it to rest, we want it to start healing. But after a few days, we start moving it, we start testing the waters, we try to start going back into our functional lives, try to start transitioning back into our normal activities. Sometimes it's stiff, sometimes it feels weak, so we start getting it moving. We don't get too aggressive with it too quickly, and we might start picking up small amounts of weight to try to help strengthen it as well. Well, it's the same thing for the lower back. We want it to rest for a day or two, but pretty quickly, we want to make sure we maintain flexibility and we maintain strength. So we have a few key movements that we're going to work on with our lower back. We have our flexing forward and our extending backwards. We have our rotating side to side, and we have more of a side bending movement. We're going to work through these for flexibility, through gentle range of motion exercises, and we're going to work on our strength through some simple isometric work. And since we're already standing, we're going to work through our side gliding movement first. We're going to keep our shoulders nice and parallel with the ground. Our hips are going to stay nice and even too. And we're just going to glide our hips off to one side so everything's nice and even. I'm just getting a nice side glide going side to side here. And while we're working on these, since we're in the middle of nursing a back injury, we want to stay in a pain-free zone. So if it hurts getting out to a certain point, go just shy of that. We're just working through that pain-free zone on this. And over time, we should start to loosen up, and it should start to let us go a little bit further and further. You want to work on this nice, slow, and gentle for a couple minutes at a time. Now our next set of exercises, we're going to need to lay down. We're going to have our knees bent, and our feet are going to be together. We're going to work through our rotation here. So you're going to let both of your knees fall off to one side. Nice, slow, and gentle. And then off to the other side. Nice, slow, and gentle. And while we're doing this one, our hips can come off the ground, should come off the ground on the opposite side from the side that they're going to make sure that we are getting that rotation in our back. We're not just keeping those square and just moving at our legs here. So our hips are moving with it. And just like our last exercise, we want to stay within a pain-free zone. So if you're starting to feel some pain, back off a little bit and just slowly work into it. And also on this one, we just need to do for a couple minutes at a time. Okay, so movement number 3. We're starting off in the same position here, but now we're rotating at our pelvis. We're going to rotate our pelvis forward so that we're trying to arch the back, and then we're going to rotate our pelvis back like we're trying to flatten the back out. So arching forward as we roll forward, and then bending the back, flatten it out as we roll backwards here. So same thing with these ones. Nice, slow, and pain-free, increasing that range of motion over time and doing for a couple minutes at a time. So now onto our isometrics. We want to get a stability ball or something similar. We're going to have it resting between our knees and our hands right here. Now in a previous video, we talked about a very specific muscle in our core, our TA muscle. If you haven't seen that video yet, you need to stop right now, head on over to YouTube, to the Physical Therapy 411 channel, check out that video before you try out this exercise. So our TA muscle, our transverse abdominis muscle here, you want to make sure that is activated. We're drawing that core in, that belly button down without moving our back or our pelvis. But now, as we draw that in, we are going to press our hands through the ball down into those knees. So drawing in, pressing down. We want to hold this for about 5 to 10 seconds at a time. And the good thing about this is as we're holding it here, we can control as much or as little force as we want to put through that. Staying within a relatively pain-free zone, pressing for that time, and then relaxing. So we have a few more isometrics left. We're gonna stand up for those. Okay, so we're gonna imagine a wall over here. I'm gonna place this hand up against the wall. My feet are gonna be slightly further from the wall than my shoulders here. All I'm gonna simply do while leaning up against here is picking up this foot that's closest to the wall. So I'm gonna lift that up. I'm gonna hold it here for that 5 to 10 seconds, and relaxing off. And if this is too painful, we can always bring those feet a little bit up closer towards the wall. We can get even closer here and put our elbow up against the wall. Same thing, we're only working on it for a couple minutes at a time for those 5 to 10 second holds. So now we're gonna come up to the same wall over here. We're gonna have the back side of one of our hands up against that wall. We're gonna place our other hand up against it here, and we're gonna try to press the back of this hand up against that wall. So we're doing more of a twisting movement here, but that wall right here is keeping us from moving. So we're turning that into that isometric work. Same thing, 5 to 10 second holds, just a couple minutes at a time. We gotta make sure that we're doing this on both sides as well. In the last exercise, we wanna grab onto a piece of rope or something that's anchored either to a ceiling or to a wall. If it's up on the ceiling, you need to step back from it a little bit. If it's up against a wall, you can stay a little bit closer. You're gonna hold it really close to yourself, and you're just gonna try to use your entire body to pull it back this way. You can keep your feet a little more forward here, bring your shoulders back a little bit more, try to increase it a little bit, but same thing here. We want to keep it pain-free. We're holding 5 to 10 seconds at a time and going for about 2 minutes here. So that's it, 7 exercises, 7 simple movements to work on while our lower back is injured to help us out with recovery. Again, I'm Mike Matthews, physical therapist with the PT411. Hope you enjoyed this video. Thanks for joining me.